Hypertension. So hypertension is your vocab word. What it means is elevated systolic blood pressure. It can be an elevated diastolic blood pressure, or it can be both. So it can be an elevation in the systolic number, the diastolic number, or actually even both. And depending upon severity, it gets classified. So we can have a pre-hypertensive stage, we can have stage 1 hypertension, capital HTN is hypertension, or we can have a stage 2 hypertension. The chart on the bottom of this slide just gives you some general ideas of where those fall. So normal systolic pressure is, less than 120, and having a diastolic less than 180. So even at 120 over 80, it's considered normal, and anything below both of those numbers is considered normal. Prehypertension is when we see a creeping up of either the systolic or the diastolic into the ranges mentioned, and then stage 1 is even higher. It does not have to be both in any of these hypertensive stage. The stage 1 or the stage 2, it doesn't have to be both systolic and diastolic. It can be either or certainly both. So we talk about the opposite of hypertension being hypotension. Hypotension is technically defined as blood pressure too low to adequately supply sufficient blood flow to meet the body's metabolic demands. So when we talk about blood flow, we talk about perfusion. Are we perfusing? Are we adequately bathing those capillary beds in blood? So hypoperfusion. And then when we talk about metabolic demands, what we're talking about is maintaining homeostasis. So are we getting enough blood flow to maintain homeostasis? When we have hypotension that leads to hypoperfusion, the pressure and the flow are related. And what we typically see are, clinical signs of critical organ shock. So we're not getting enough perfusion, we're not getting enough blood flow to critical organs. We have 4 basic forms of shock. The first one we're going to talk about is hypovolemic shock. Hypovolemic, hypo, low, volemic, volume. So we have a low blood volume, a decreased blood volume, and that's hypovolemic shock. Our second one is cardiogenic shock. Cardiogenic is shock that's of the result of poor heart function. The heart is not performing adequately, and therefore we're not getting the appropriate level of perfusion to critical tissues. The third one on our list is obstructive shock. Obstructive shock is hypoperfusion secondary to some sort of obstruction of the blood flow. Something is blocking the way. There's plenty of blood volume, the heart is doing its job, but something is preventing that blood from reaching the tissue. It's blocking the flow. And the fourth one is, our final one is vascular shock. Vascular shock happens as the result of a vessel change, specifically a vasodilation. So we have a normal blood volume, the heart is pumping normally, there's nothing obstructing the way, but the blood vessel diameters are so large that I lose blood pressure. So vascular shock, as I said, is due to vasodilation. We can see it in the case of a massive allergy, an anaphylactic response, or we can see it in the case of sepsis. So sepsis is infection and inflammation within the bloodstream. Data is old, so my stats on this are a little bit older, but we see septic shock cases in the U.S. at greater than 100,000 deaths per year. So if you can just picture 100,000 people, and 100,000 people are going to, or more, are going to die each year from septic shock. It's the most common cause of death in the hospital critical care units, and it's that failure of controlling the infectious process and the immune system response to it. we need to touch base on the hepatic portal system. I'm going to end the video. We're going to come back and pick up hepatic portal because I think it deserves its own separate video set.